Oh. Okay, roll them. This is a tape.
Kokendorfer is absent. Notice. Bowman.
Here.
Middleton.
Here.
Wipers. Spiz.
Present.
Lakewood notice.
Zach.
Here.
Hoffman.
Present. Please join me in the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. You have before you the minutes of our previous meeting of August 23rd.
So moved.
By Commissioner Spiz, supported by Commissioner Middleton. All those in favor signify by saying aye.
Aye.
Opposed, same motion carried. On our agenda today, we're going to add item number D under communications, fiscal year 2018 salary recommendations for the judges, in particular probate judges. And at that time, before we vote on those communications, I'd like HR to just give us a little explanation of what we're doing. Any other additions or corrections to the agenda? Hearing none, I'll
Move to approve as
moved by
amended.
Commissioner Spiz, supported by Commissioner Zach. All those in favor signify by saying aye.
Aye.
Opposed, same motion carried. Is there anybody here for public comment? All right, we'll move on to the regular agenda, please. And the first item is miscellaneous resolution 17245, the Sheriff's Office medication assisted treatment program interlocked agreement with Oakland Community Health Network and reimbursement for inmate casework specialist position working on MAT program and Jail Alliance with Support program. We have with us Matt Costalde, Supervisor of Inmate Services, and Lieutenant Melissa McClellan.
Would you like a motion?
Oh, yes, I will. Moved by Commissioner Zach, supported by Commissioner Middleton. Thank you. And
Good afternoon, Mr. Chair. We're here to answer questions about our medication-assisted treatment program.
Commissioner Zach.
Okay, so I think it's great to have more casework services and that we're trying to address some of the opioid coming in. When I was I was looking for what the MAT services will include. So will a doctor be ordering the medication? I'm looking at 2.6 on the contract. There's going to be behavioral health, there's going to be peer support, screening, testing, prescribing, dispensing, administering the medications. Obviously, a social worker or a caseworker can't administer, so part of the medical care will be prescribing medication for these people? I'm just trying to understand.
Yes, we've entered into a cooperative agreement with Oakland County Health Network and their provider network, primarily Sacred Heart, which is a licensed substance abuse MAT protocol compliant facility. So the tentacles of this particular program is going to be first and foremost the Sheriff's Office will identify those candidates that would be eligible for participation into the MAT program. Safety and security are certainly going to be the first filters that a person will have to go through. Once the Sheriff's Office has identified a potential candidate, we would contact OCHN and their screening network to come in, interview the person, and contact Sacred Heart for that doctor, who's also an addictionologist, to come in to conduct an evaluation, to prescribe a course of treatment that would include medication for those that are eligible to participate into the program. This is also, it's not just medication only. The Sheriff's Office, and being consistent with the MAT protocol, we're importing other services, a peer support specialist, as well as some other people. So I'm sorry.
So my history of working with Sacred Heart, they used to have a treatment facility downtown and in Memphis,
Mm-hmm.
and so they have staffing that can come in, into our jail.
Yes, what they've entered into a new contract with Oakland County Community Health Network for this specific kinds of program. It was sent out on an RFP. Really, Biomed and Sacred Heart are the two licensed facilities currently within that network to provide these particular services. Currently, Sacred Heart is the identified provider. They are going to expand their services to the point of bringing in this addictionologist to do the evaluations, as well as run the group services and the peer support specialist.
So are we going to be doing some type of outpatient detox in the jail? Is that?
The Sheriff's Office and through Correct Care Solutions has been running detox since ever I started into the jail, so
Really?
that's going to
Okay.
continue. The people who are in this MAT protocol, however, they won't obviously be in a detox program. They'll be participating in the opiate cessation program, the MAT protocol. Those who are ineligible for that program would certainly be safely, medically detoxed from that drug or drugs of choice.
Okay, thank you.
Any other questions? Mr. White?
A part of the whole program is they come in and they're addicted and they detox at the jail and then they go out and they OD. And so as part of this whole program, we're gonna kind of give them that counseling and kind of give them some tools.
We're not going to kind of give them anything. We're going to be very aggressive in terms of who we're going to seek out, provide that treatment. It's really, as you mentioned, an excellent point, is that is a large concern is that the people who release from a correctional facility back into the community who are opiate involved go out, use at the same levels, and die as a result of that. So putting them in a structured program shows, again, there's less than 1% of the jails in the country that are running this kind of protocol in the jail system. But the early data shows that not only does it reduce those post-release deaths, it also reduces the likelihood that they reoffend and come back to our jail to begin with, which again is something that the Sheriff's Office is interested in achieving also.
And the numbers on the country, I mean, I know you saw this on the news with Governor Christie, he's calling it 911 every 3 weeks.
Right.
9/11, that many people died. Same number that died at Twin Towers every 3 weeks are dying in opiates.
Right.
And that's
It's
amazing numbers.
It's why we're here today.
Thank you.
Commissioner Bowman?
Yes, I had an inquiry specifically about the MAT advisory team.
Mhm.
It notes that the sheriff and/or a designee that he identifies, as well as the director here of Oakland Community Health Network, would ultimately serve as deciding entities on how this program will function. Do we have any idea, if not the sheriff and if not just the executive director, who these designees would be, who these individuals that would be ultimately dictating this program?
Well, I think that's still evolving. Again, because it hasn't started up yet, I think that Executive Lieutenant McClellan has been an integral part of this process and is intimately familiar with the details of it. But who would represent the Sheriff's Office in that, I'm not qualified to speak to. Certainly from the Oakland County Health Network arena, Christina Nicholas has been spearheading it from their end significantly. Well, whether or not she retains that position on this advisory board or not, I can't speak to all either.
Just a additional point of inquiry. Our Oakland County Health Network, they also provide health services for Children's Village. Is that accurate?
The substance abuse services, I think that they are involved in. They're not the health I mean, they're. I guess it's a correct.
Thank you.
Any other questions? Roll call, please.
Bowman,
Yes.
Middleton,
Yes.
Wyper,
Yes.
Spiz,
Yes.
Zach,
Yes.
Hoffman.
Yes. Thank you very much. Thanks, Matt. Executive Lieutenant Melissa McClellan, Williams Snarley, and Frank Russell. Thank you guys very much. All right, the next item then is Human Resources Department fiscal year 2017-2018 collective bargaining agreement for the employees represented by the Michigan American Federation of State, County, and Municipal Employees, Council 25, Circuit Court, Family Court employees. Moved by Commissioner Wyper, supported by Commissioner Zach.
Good afternoon.
Jordy?
This is a collective bargaining agreement for the employees that are represented on a circuit court. It's approximately 85 employees. Their contract is expired. It expired last September 30th. We continued to work through this past year to negotiate this contract. We did end up in mediation, and the agreement before you is what we have agreed upon. I will say this is consistent with the labor contracts that came before you last year in regards to the wages. And I'll just walk you through. It's a 2-year contract, so it expires September 30th, 2018. This is for fiscal year 2017. It's a 2% increase. And then for fiscal year 2018, what was put in was a 2% with a Me Too. So should the increase be greater than, they would be given the greater increase. There was one particular classification that was looked at specifically for salary, and that was the personal protection order liaison. And that salary was not appropriate when we started the bargaining session, and as we looked at the classification, we determined that that particular classification would receive a separate increase as noted. This group has a Me Too for benefits in regards to health care, retirement, and employee benefits. They will receive the match for the deferred compensation, which was set at $500 as of January 1. They will receive that match as soon as this is passed by the board. And then we added in the updated emergency manager language.
Does anybody have any questions? Mr. White?
What was the holdups? I mean, it's basically following what we've done across the board.
They had
Classifications, or
they had
was it-
initially asked for some higher salary increase for their employees. That as we reviewed their request, we did not see that it was appropriate for the classifications.
Thank you.
Mr. Spiz?
Since it does include fiscal year 17, which we're currently in.
Correct. They will not receive retro. The Public Act,
Everybody understood.
the Public Act does not allow for retro. I did request that this be fast-tracked, so we have a pay period in between the passing of the new budget, and that helps us get everything squared away, so they will have the increase for 2017, one pay period before they receive the increase for 2018.
Any other questions? Commissioner Bowman?
This bargaining agreement, I'm just trying to clarify, is this limited to the family court, or is this the circuit in its entirety?
This is circuit court. The employees that are included would be the youth and family caseworkers, support staff, and deputy registrars. So there's only 85 employees represented.
Any other questions? The motion then probably should include the fact that this is a request for direct referral to finance tomorrow.
Separate
We'll do a
motion.
separate motion then. All right, roll call on the first motion then.
Paul Middleton,
Yes.
Wyper,
Yes.
Spiz,
Yes.
Zach,
Yes.
Bowman,
Yes.
Hoffman.
Yes. Thank you, motion carried. The request,
So moved.
moved by Commissioner Spiz, supported by Commissioner Wyper, for direct referral to finance tomorrow. Any discussion, questions? All right, roll call, please.
We want to work that hard tomorrow.
All voice vote, all in favor signify by saying aye.
Aye.
Opposed, same, motion carried. Thank you, Jordan.
Thank you.
The next item then is communications. And as I indicated at the beginning of the meeting, item number B, we added, if I could ask Jordy to just give us a quick overview of what.
I move to receive and
Moved,
file.
okay, by Commissioner Swins, supported by Commissioner Middleton. Yep.
So we received a letter from the State Court Administrator's Office that had updated salary information. We want to make sure that what is before you for the budget is accurate and has the appropriate number in it for the salaries for the probate judges.
That's this document you handed out this morning.
Yes. It has the updated salary information. On page 4.
Go ahead, Commissioner White.
And then the memo from the state, court administrator's office, August 16th, that was.
They came in, yes, after we presented, then we got the memo.
Good.
And just for the record, it's something that the Board of Commissioners doesn't have any real oversight over, comes from the state.
Correct.
Any other questions? All those in favor signify by saying aye.
Aye.
Opposed, same motion carried. Jody, thank you very much.
Thank you.
Is there any other business today? Hearing none, we are adjourned. 1:54.
We have a TIF meeting just after this. We don't have to wait until 2 o'clock, do we?
No, we set it for 1:45.